Hi, my name is Samantha Allen, and I'm going to be explaining joint movements and showing you them. So to start off, we have flexion. It is a movement that decreases a joint angle, usually in the sagittal plane. This is particularly common at hinge joints. For example, bending at the elbow so that the arm and forearm go from 180 angle to 90 or less. It occurs in other types of joints as well. The meaning of flexion is perhaps least obvious in the ball and socket joints of the shoulder and hip. At the shoulder, it means to raise your arm as if pointing at something directly in front of you, or to continue in that arc and point towards the sky. At the hip, it means to raise the thigh, for example, to place your foot on the next higher step when ascending a flight of stairs. So, for example, for flexion, it would be like this, and this is extension, this is hyperextension. So then we move on to extension, is a movement that straightens a joint and generally returns a body part to the zero position. For example, straightening the elbow or wrist or knee, returning to the arm, thigh, back to zero position. So this is flexion, and this is extension. Next we're going to do adduction, is the movement of a body part in the frontal plane away from the midline of the body. For example, moving the feet apart to stand spread-legged or raising an arm to one side of the body. Adduction is a movement in the frontal plane back towards the midline. Some joints can be hyperadducted, as when you stand with your ankles crossed, cross your fingers, or hyperadduct to the shoulder to stand with your elbows straight at your hands clasped below your waist. So, abduction is like this, and then adduction is like this. Next we're going to do protraction, is the anterior movement of a body part in the horizontal plane. Retraction is the posterior movement. Your shoulder protracts, for example, when you reach in front of you to push a door open. It retracts when you return it to the resting zero position or pull the shoulders back to stand at a military attention. So this is protraction, like this, and retraction is like this, like just sitting straight. Circumduction, one end of the appendage remains fairly stationary while the other's end make a circular motion. If an artist standing at an easel reaches forward and draws a circle on a canvas, she circumducts the upper limb. The shoulder remains stationary while the hand moves in a circle. A baseball player winding up for the pitch circumducts the upper limb in a more extreme windmill fashion. One can also circumduct an individual finger. The finger, the hand, the thigh, the foot, the trunk of the head. So this is circumduction. Like this. Next is rotation. Rotation is a movement in which a bone spins on its longitudinal axis like a bicycle wheel. For example, if you stand with bent elbow and move your forearm to grasp your opposite arm, your humerus spins in a motion called internal rotation. If you make the opposite action so the forearm points away from your trunk, your humerus undergoes lateral external rotation. Good examples of lateral and medial rotation of the humerus are its movements in the forearm and backhand strokes of tennis. The femur can also rotate. If you stand and turn your right foot so your toes point towards your left foot, then turn it so your toes point away from your left foot, your femur undergoes medial and lateral rotation respectively. So this is medial internal rotation, like inward. And then lateral external rotation is outward, and your foot is out like this too. Oh, okay. Supination of the forearm is a movement that turns the palm to face anteriorly or upward in the automatical position. The forearm is supinated of the radius is parallel to the ulna. So supination, I don't know, sorry if that's not how you say it correctly. It's like this. The radius and then the ulna of your, like in your bone. And then pronation is the opposite movement, causing the palm to face posteriorly or downward, and the radius to cross the ulna like an X. During these movements, the concave end of the disc-shaped head of the radius spins on the capitulum of the humerus, and at the edge of the disc spins in the radial notch of the ulna. The ulna remains relatively stationary. So this is pronation. Supination, pronation. Next is dorsiflexion. A few additional movement terms are unique to the foot. Dorsiflexion is a movement in which the toes are elevated, as you might do to trim your toenails. In each step you take, the foot dorsiflexes as it comes forward. This prevents you from scraping your toe on the ground and results in the characteristic heel strike of the human locomotion when your foot touches down in front of you. Okay. And then plantar flexion is a movement of the foot so the toes are pointed downward, as in pressing a gas pedal of your car standing on tiptoes. This motion also produces a toe off in each step you take as the heel of the foot behind you lifts off the ground. Plantar flexion can be a very powerful motion by high jumpers in the jump shots of basketball players, and I will show you that. Okay, so this is dorsiflexion, like your foot is like this. Zero position, your foot just normal. And then plantar flexion, which is like up on your toes like this. And yeah.